Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing the combination product of Emtricitabine and Tenofovir. The brand name would be Truvada. Now, before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. In this presentation, we're going to talk about the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Truvada. We'll then discuss examples of dosing and then follow it up with side effects. I put together some slides to go over this information, so let's just jump right into it. So the first thing to talk about here would be the mechanism of action, or how this medication works. So emtricitabine is a synthetic nucleoside analog of cytidine. The active metabolite inhibits activity of HIV-1 reverse transcriptase by competing with the natural substrate deoxycytidine 5-triphosphate, which is then incorporated into nascent viral DNA, resulting in chain termination. Tenofovir diphosphate competes with deoxyadenosine 5-triphosphate, which is then incorporated into DNA, resulting in chain termination, thus preventing the activity of HIV-1 reverse transcriptase. In terms of indications or reasons we prescribe this medication to a patient, we may see it used for an HIV infection or for HIV infection pre-exposure in high-risk patients, so used prophylactically or preventatively. In terms of contraindications or reasons we would not prescribe Truvada, this medication would be contraindicated in HIV-1 pre-exposure prophylaxis in individuals with unknown or positive HIV-1 status. Now for dosing with Truvada, so when treating an HIV infection, emtricitabine 200 mg and tenofovir 300 mg, which would be one tablet, would be taken orally once daily with or without food. And for pre-exposure prophylaxis or prevention, you would use one tablet once daily as well. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Truvada, so we'll go over some of those here now. 7% of patients may experience a rash, while 9% may experience nausea. Diarrhea may happen 9% of the time, and abdominal pain may happen in 4% of patients. A backache may happen 5% of the time. Again, 5% of patients may experience myalgia. Dizziness may happen 8% of the time, and a headache may happen 6% of the time. 5% of patients may experience insomnia, and as well 5% may experience peripheral neuropathy. 9% of patients may experience depression, and a dream disorder may happen 10% of the time. Pneumonia comes in at 5%, and fatigue at 9%. Now, one serious side effect would be something called Fanconi syndrome. Alright, that's all we're going to talk about today with Truvada. As always, I'm very thankful you took the time to come by and watch one of my videos. If you'd like to support the channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. So for today, take care.